Hi, I'm Abby, Careers Information Specialist with Health Careers. I'm really looking forward to speaking to you all at National Graduate Week and answering some of your questions about the range of career opportunities in the NHS. The huge range of roles really will surprise you. And we've also got graduate schemes, postgraduate accelerated courses, conversion courses, apprenticeships and grants available too. So there really is something for everyone. See you on Thursday, 24th September at 1 p.m.
Good afternoon, everyone. Welcome to National Graduate Week's live event with NHS Health Careers. We've got an exciting session for you to help you make some decisions along the way in regards to pathways and careers in the NHS. There's probably much more than you're even aware of. You'll see on the side of your screen there is a chat box. Feel free to say hello, Billa, and make any comments or questions along the way. We'll be able to answer your questions during the session, but there's also going to be a full Q&A at the end. So if we don't get to your question during the session, don't worry. We've got a beady little eye of the chat, and we'll be keeping a close eye on the questions so we can answer them later. If you can, great. It's lovely everybody's saying hello. Hello, everyone. Nice to have you this afternoon. I'd like to introduce Abby Changer from the NHS. She'll give you an overview of who she is and more about the part of the NHS and what they are going to be offering in terms of the careers information. I'll disappear off and I will join you later for the question and answer session at the end. Over to you.
Thank you very much, Sharon, and good afternoon, everybody, and welcome to this session. It's really great to be able to be here as part of National Graduate Week and to be able to speak to so many of you about just some of the things that are on offer within the NHS for graduates. My name's Abby. I'm the Careers and Information Lead for the Health Careers Service in the NHS. We cover England, going to be talking for about half an hour or so, and then plenty of time for questions. You can also see at the bottom of all the slides there various handles and URLs, etc., and also the email address and the phone number for our Health Careers Contact Centre. So if we don't get round to all your questions today, or if there are very specific kind of niche questions that you've got, then you'll be able to contact them afterwards as well. So don't worry if we don't get to your question today, but hopefully we will. Okay, so you are all very welcome, whether you are here because you are absolutely sure that you are wanting to pursue a career in the NHS and you're very clear in your mind as to what that career is, or whether you're here just to see what we've got on offer and to kind of, explore some of the possibilities. So welcome to all of you. Okay, so what we're going to cover then is a little bit of background and context, talk a bit about some skills and interests that you may have and how they translate into some of the roles we have, and then to talk you through some of the graduate opportunities that are available. And these are both clinical roles, so very patient-facing hands-on roles, and non-clinical roles as well. We're also going to talk about some of the financial support available, and then I will show you some of the resources that we have and how to use the NHS Jobs website to its sort of full potential. And then some other links and resources as well that you're very welcome to screenshot once we get to the end there. Okay, so one of the main messages I want to get across today in this session, well, for a start, we have got 350 plus different roles in the NHS, and people generally are aware of very, very few of those. The other sort of messages that we want to get across are the fact that it's not all about the patient-facing roles, but that there are roles where you're working behind the scenes, possibly based in a laboratory or based in an office or at the end of a telephone, but where you're still absolutely making a difference to people's lives. And that's one of our main messages, really, that You know, whatever you're doing, whether it's in finance or whether you are really there on the front line, you know, working hands-on with patients, you're making a difference to lives. And we've seen over the last few months with everything that's happening with COVID as well, that for a lot of people, that's quite a big driver in terms of the sort of career that they're wanting to pursue, that feeling of making that difference. Okay, so a little bit of background then and context, which and hopefully as I talk, you'll see why this is relevant. So NHS healthcare is delivered by more than 1,000 organisations in England, and each of those organisations is an employer in its own right, and therefore each one of those is responsible for its own kind of work experience programs it may have on offer, the types of training posts that are on offer and the number of training posts, the staff development that's on offer, and the apprenticeships that they are advertising. So even if you've got one NHS trust, you know, 10 miles up the road from you that is offering, let's say, for example, registered nurse apprenticeships, that doesn't mean to say that another NHS trust 15 miles the other way is going to be doing the same thing. It can be a little bit confusing, but it's very much something that you need to be aware of, that employers as well might, for the same job, have slightly different entry requirements in the person specification. So to really be aware of those differences. Okay, just for those of you that like a fact and figure, so the NHS is the 5th biggest employer in the world, employs about 1.7 million people if you take into account Northern Ireland, Scotland and Wales, as well as England. So it is huge, and I think for those of us that do work in the NHS, there is a sense of pride that comes with working for what is often, you know, considered a national treasure. And as I've said, I think, you know, COVID has really brought the NHS to the forefront of many people's minds over the last few months. Okay, so I mentioned this briefly at the beginning. The NHS is not just doctors and nurses. You know, unfortunately, media often sort of perpetuates that idea. And I've done a lot of work with schools in the past, and quite often when I ask young people to tell me what roles they know about in the NHS, they'll mention nurse, doctor, midwife, physio, maybe paramedic, and that's usually about it. But, you know, hopefully many of you on this session today are already aware that there's a lot more than that, but it's a really important message to remember. Okay, so what sort of careers are there then? So we have sort of tried to group NHS careers under these professional groupings that you can see here, and I appreciate that depending on what sort of device you're watching this on, these could be the text could be quite small. We're just going to briefly run through them, not go into detail. And actually, this whole presentation, because there are so many opportunities for graduates within the NHS, we're not going to be able to really dive deeply into any one specific area of that. But really, the idea is to give you an overview and to also signpost where you can go if you want to find out more. So we've got the allied health professional group then, which is a group of really important staff, and a lot of people just don't really know that that's the terminology we use for that particular group. So this group includes roles such as physiotherapists, speech and language therapists, radiographers, arts therapists, paramedics, operating department practitioners, and many more. There are 14 different AHPs, as we call them. And for many of them, their role is about trying to enable somebody to live their best possible life, have their best possible experience, no matter what their physical disability or what illness or pathology they might be dealing with. There's the ambulance service team then, and this isn't just the paramedics, but we've got people working in the call centres as well. The dental team, and again, that's not just dentists, but a team of dental care professionals working alongside them. Doctors with the 60+ specialties that they have. Health informatics, which is a really growing area within health. Obviously, we know, and this applies across many sectors, that data is important. Data drives and improves quality of care. And so we need health informatics experts who are able to analyse, manage, store that data. Healthcare science, and this is one of the areas that we will be talking a bit about today. So I would say that this group of staff probably has come to the forefront of it during COVID because of the focus over the last few months. And there are some really exciting career pathways within the healthcare science. And then management, and obviously NHS trusts are huge organisations with huge turnovers, and we need managers of all sorts, whether that be finance or HR, operational managers, clinical managers, etc. And we'll talk a little bit more about that later. Then we've got perhaps some of the relatively newer groups of staff, so the medical associate professions, such as physician associates, which we'll talk about a little bit later on. Midwifery and nursing, and within nursing there are 4 fields: adult, children's, learning disability and mental health. Pharmacy then, and again, not just pharmacists, but pharmacy technicians and assistants. And the psychological professions, and again, we'll be spending a little bit of time with that. Obviously another growing area because of our growing incidence of mental health challenges within our society. So the psychological professions are really expanding, both in terms of numbers and types of roles, but also numbers of staff within and need within those particular groups. Public health, and again, something that has been very much in the public eye over the last few months. And then the wider healthcare team, which incorporates many other members of staff. Every single one of those groups is vital to how the NHS functions. We just wouldn't be able to have a functioning service if any one of those groups was missing. Okay, this is just to give you a little bit of an idea about the sorts of skills or preferences that you might have, and just some of the roles that might fit well with that. So this is by no means this is not an exhaustive list, but it's just to start to give you some ideas. So if you're a very practical person, these are just some of the potential roles that as a graduate might be of interest to you. So everything from prosthetist to clinical scientist in respiratory and sleep sciences, a surveyor, occupational therapist, clinical photographer, etc. As I said, definitely not an exhaustive list. Okay, for those of you that are keen to work with children, obviously children's nurse, one of the more obvious ones, but then also music therapist or education mental health practitioner, which is one of the newer roles in the psychological professions, speech and language therapist who can specialise in working with children, and healthcare science practitioner in audiology. Again, not an exhaustive list, but just some ideas for you. Science, and I imagine we've probably got quite a few people on this presentation who are very interested in science. And are already either undertaking a degree in science or have already graduated. So dental, a pharmacist, pathologist, physiotherapist, many careers that include have a requirement for an interest and skills within science in the NHS, which won't be a surprise to you, I'm sure. And then for those of you that would rather not deal with patients face to face, and that, there's nothing wrong with that. Everyone's got different preferences. And for some people, they want to be doing something that makes a difference, but don't want to have to actually come face to face with patients. So biomedical scientists, project managers, procurement leads, strategic development manager, finance manager, again, just a taster really of the sorts of roles that might suit you. Okay, so to get onto some of the opportunities then that we have within the NHS, and we're going to start with the clinical opportunities and science more specifically. So the scientist training programme is a really popular postgraduate training route within the NHS. And I appreciate there's quite a lot of information on this slide. I believe the slides will be available to you in I'm not sure, I think it's potentially a few days' time after this. So, you know, if you don't manage to take in all the information you want to now, then don't worry, it will be available. So this is a master's programme to become a clinical scientist, and it's a 3 years paid training position within the NHS. And just to give you a little bit of an idea about the competition sort of ratios, so in 2018, there were 20 applications per place and heading for about 300 places. There is a yearly application cycle, and applications for next September, so September 2021, are due to open in January 21. The recruitment window is usually open for about a month. But if you are interested in this, do keep a very, very close eye on the National School for Healthcare Science website and also the Health Careers social media channels, because we'll make sure that we publicise the closing date for that. So the National School for Healthcare Science is the body that manages all the applications and the recruitment for this. And there's a lot of information on their website about eligibility criteria and further information, etc. So usually you would need a first or a 2-1 in an undergraduate honours degree or integrated master's degree in a pure or applied science subject. However, if you've got a 2-2 honours degree in another subject plus a higher degree in a relevant subject, then you can also apply. But as I said, do have a look at the National School for Healthcare Science website, and it's one of the links that we'll put up at the end of the presentation. And you will be able to see much more information about that particular programme. So as I said, so that's a postgraduate programme. It's a master's programme for 3 years, which enables you to become a clinical scientist, which is a protected title and means you're registered with what's called the Health and Care Professions Council, the HCPC, as a clinical and able to work as a clinical scientist in this country. Regulation is a topic that I will mention every now and again. So quite a few of the professions that we talk about are you do have to be registered. It's a statutory requirement that you are registered with a regulatory body. So for example, for nursing, it's the Nursing and Midwifery Council. For if you're a doctor, you're regulated by the General Medical Council. So any training that you undergo to become one of those registered health professionals must absolutely meet the requirements of the relevant regulatory body. But as I said, we will keep coming back to that as we go through. Biomedical scientists then. So for people who have, for example, done a biomedical science degree, and those of you that have done that will know that some degrees are accredited by the Institute for Biomedical Science, the IBMS, and some aren't. But in order to become a biomedical scientist and have that, that statutory title, then you do need the IBMS accreditation in order to be registered with the HCPC. And the practitioner training programme we are seeing is becoming one of the major routes to becoming a biomedical scientist. But if you haven't done the practitioner training programme, then you can still get there. Now, what we see, so jobs as trainee biomedical scientists will be advertised in NHS jobs, and again, that will be another link we'll give you at the end. Trainee biomedical scientist posts are, it can be a little bit tricky because it can feel a little bit like catch-22 in that some of them say you need some experience already in the NHS, whereas some don't, and some you're able to access straight away as a trainee biomedical scientist and complete your relevant competences and portfolios in order to be able to become HCPC registered. So that's just something to be aware of when you're looking at adverts on NHS jobs. Check in the person specification and see exactly what they're asking for. Okay, so to move on to some of the psychological professions then. So again, sticking with clinical opportunities. So one of the main ones is this group psychologists, And within the NHS, the 4 main types of psychologists that are employed are the clinical, the counselling, forensic and health psychologists. And these roles are very much suitable for a psychology graduate. And I imagine we may well have quite a few of those on this presentation now. So in order, this is for the clinical psychology training. In order to access that training, you need a 2-1 in a psychology degree or a conversion course, and this needs to be a BPS accredited, so the British Psychological Society accredited course, plus experience, and then you are able to apply for the 3-year clinical psychologist doctorate training, which is a paid training position. The other psychologist routes do differ, and as I said, we haven't got time to go into all of them now, but again, we will give you some good links that will enable you to find out more about those. For most of the for all of the psychological professions, what you'll find is that experience is really, really important. So you don't see people going straight from a psychology degree and being able to access these training programs in general. Usually people do need to build up a good chunk of experience in order to be able to access these. They are very competitive. Okay, then we've got the psychotherapists. So these aren't purely for psychology graduates. So again, substantial experience is required. And within the NHS, there is funding for the child and adolescent psychotherapist 4-year training programmes. Psychological wellbeing practitioners, these are relatively new posts in the psychological professions. You do not have to have a degree in psychology in order to be able to access the training, and you would apply via NHS jobs for a 1-year training post. These roles work in what's called the IAP service, which is improving access to psychological therapies. And it's very much a drive within the country to try and make it easier and quicker for people to access the mental health support that they need. So psychological wellbeing practitioners and high intensity practitioners, which we're just about to come on to, are both very much part of that IAP service. A little bit of a word of warning about some of these psychological positions. Sometimes these roles are based within charities. So the NHS will sort of move those posts out into charities. So we have been aware recently of some training positions that didn't end up being advertised on NHS jobs, but were advertised by a charity. So charities such as Mind and Rethink, and others do sometimes end up advertising these positions, but they are NHS funded training positions. We've got the high intensity practitioners, again, as I said, part of the IAP service. Usually the training for these posts are accessed by experienced healthcare professionals, although there is an equivalence route available if somebody isn't a healthcare professional, but they would need a substantial amount of experience and learning to demonstrate that they were able to access that postgrad diploma. And again, those are advertised on NHS jobs, and it's a 1-year training position, paid training position. Education mental health practitioners and children's wellbeing practitioners, these are really quite new posts. Again, experience is necessary for these. These are open to graduates and non-graduates. And again, you apply via the NHS jobs platform, and it's a 1-year training post for both these positions. These are really part of the government's drive to try and deal with the increasing amount of mental health challenges that we're seeing among school-age children. So education mental health practitioners, as the name kind of suggests, you'd be working very closely with the education system in terms of being able to provide early support to children suffering from mental health challenges. Okay, so then some of the other clinical opportunities. So physician associates, these are part of the medical associate professions that I mentioned at the start. So this is a role that really started off in the States. and has come over here relatively recently, but is really growing in popularity and in numbers. So physician associates are very much trained in the medical model, and they are part of the medical team, so working alongside doctors and under the supervision of consultants. And it might be a really suitable role for someone who perhaps decided that medicine wasn't quite for them, or didn't manage to make it to medical school, and this is a really good option for you if that's the case. Most of the training is postgraduate, and it's a 2-year, on the whole, a 2-year PG DIP or MSc course. But we are seeing there are now a couple of universities offering an undergraduate option. And they are usually aimed at bioscience-related graduates. These positions aren't funded in any way, so you would undertake your 2-year course at university in the normal way and then apply for a job. And we're seeing physician associates being used in GP practices, for example, running their own clinics, seeing their own list of patients, but also in secondary care, so in hospitals, working in emergency departments, on the wards, and actually bringing a lot of stability to the medical team, because they're not rotating around in the same way that many doctors in training are. Then we've got the arts therapists, so music, drama and art therapy. Usually you would need a degree in a relevant area, so music, drama or art, but not always. So if you are interested in that and you don't think you've got the right qualifications, do explore that as an option. And actually this leads me to an important point. Many universities, and you will know this from having applied for your undergraduate degree, that the entry requirements can vary really quite significantly from university to university. So it is always really important to check and see, and if possible, phone up, have a conversation with the admissions tutor if you can, because it's not always as clear cut as it can seem from the university's webpage in terms of what they'll accept. The courses for these are usually 2 to 4 years. And I've put in a note there about the limited number of posts, and that's just so that we're realistic, really, about the number of opportunities there are for these roles. There are not a lot of them out there, so the whole labour market information piece is important, because we know that we don't need thousands and thousands of art therapists, because there just aren't the vacancies there. Okay, and then public health specialty training. So you don't have to be a doctor to apply for public health specialty training. The recruitment for August 2021 posts will open in November, and that's managed by a platform called Oriel. And there are about 60 to 90 places a year, and it's a 5-year training programme. Just to give you an idea, either last year or the year before last, I can't remember which, the competition ratio was about 7 to 1 for places on the public health specialty training programme. Okay, and then last but definitely not least, in terms of other clinical opportunities. So you can see here a list of different roles where you can do an accelerated programme if you are a graduate with the right type of degree, in order to achieve this registration as one of these registered healthcare professionals. And in brackets there, you can see the number of years that generally these accelerated courses take. And as I say generally, because occasionally there are slight differences, but on the whole, this is the length of time that it will take. And actually, the other important message here is that even if you haven't got what you might think is a relevant degree for one of these roles, you will be surprised as to what the universities will accept. And actually, sorry, I should explain what APEL means for those of you that don't know. So that's accreditation of prior experiential learning. Sometimes it's also, so that's very much about experience, but there's also accreditation of prior learning as well. So they will look at your particular degree. They'll look at sometimes the particular modules within your degree to see whether you've done enough on certain topics. In order to make a decision about whether you can access one of these accelerated courses. So these are really important roles to be aware of, and would really encourage you to have a look into those and to see whether it's one of the roles that you might be interested in. There is a lot more information about all these things that I'm talking about on the Health Careers website, so please go and have a dig around on there when you've got the time. Okay, moving on to some of the non-clinical opportunities then. So many of you may have heard of this, the NHS Graduate Management Training Scheme. It's a really popular grad training scheme, very competitive entry, and the great thing about it is that it doesn't matter what degree discipline you've come from. The minimum entry requirement is a 2-2 in any degree discipline, and it's a 2-year paid training program where you choose from one of 6 streams. You can see there financial management is actually 2.5 years because of the qualification that you undertake during that, but the rest of them are 2 years. So you've got financial, general management, human resource, informatics, policy and strategy, and health analysis. And these are great schemes because you're getting in there, you're getting stuck in the workplace and learning on the job and drawing from those around you. So you can see that applications for next year are going to be opening next month. You can register your interest now on the grad scheme website, and again we will put that link up at the end of the presentation. For September 2019 entry, just again to give you a little idea in terms of competition, 9,000 applications for 262 starts, so it is competitive. There is a staged assessment process, and I'm just going to move on to the next slide here. So just to give you some really up-to-date information on where they're up to with numbers. So after the initial application process, those candidates are whittled down to be invited to an assessment centre, and then following the assessment centre, the places are allocated. So this year, there was due to be a September 2020 intake. There were over 11,000 applications. 700 people were invited to the assessment centre, but because of COVID, this month's intake has been postponed. So actually they're right this week undertaking the virtual assessment centre to further narrow down those 700 candidates. 250 of those will start in March next year, and others will start next September. But they are still opening a recruitment window this year for next September as well. So next September's intake will be a combination of people who applied last year and people who will apply this year. And they intend to have an intake of 350 people for the September 2021 start. So I would encourage you to, if you're interested in that, as I say, really popular scheme, really highly regarded, and get your interest registered with them as soon as you can. Just going to have a quick sip of water. So some of the other non-clinical graduate opportunities then, and these are much smaller schemes, but still very beneficial and really do give you that fast track. So there is a scheme called Graduates into Health. It is relatively new, and they do tend to work with the main graduate management training scheme actually to and can use some of their applicants. There is very much a focus on information management, IT, project management, HR, comms, finance and business admin roles. Again, it's a 2-year program. Again, you are paid during those 2 years, and they have sort of a rolling recruitment cycle, but generally speaking about 3 intakes per year. Again, this will be a link that we put up towards the end of the presentation. So if that sounds of interest to you, please do head over to the website and have a look and see when they are next planning to recruit. For any of you that have got a Royal Institution for Chartered Surveyors degree and are interested in NHS property services, then they also run a 2-year graduate surveyor trainee programme with an annual recruitment cycle. So check out the website if that's of interest to you. And then the NHS Digital Graduate Scheme. So this is very much aimed, as you would expect, software developers, data scientists, that whole sort of product and delivery management and user-centered design. Again, a 2-year programme, paid post, and you apply via NHS Digital. Again, I think that's a link that we include at the end, but you can also find it just by using a search engine. And then there are other non-scheme opportunities. So there are roles that you can go into as a graduate that you don't need to join a particular scheme for. So roles within health informatics, whether that's as a librarian or a statistician, depending on your degree discipline, operational management, engineering posts, human resources and finance. And you would find these opportunities via NHS Jobs. The other thing I ought to mention at this point is that some NHS organisations, for example, particular NHS trusts, do run their own graduate training schemes as well. And Health Education England as well, which is the part of the NHS that the Health Careers Service is based within, also runs its own graduate training programme. So, for example, I know Guy's and Thomas's hospitals run a graduate training programme, and many other NHS trusts do as well. So it's always worth having a look at those, getting in touch, having a look on their website and seeing if they run anything like that too. So hopefully you've seen that there are lots and lots of options out there, some of them very formal, some of them less so. Apprenticeships are becoming more and more prevalent in the NHS as they are across many, many other sectors. And not only apprenticeships at the lower levels, so sort of equivalent to GCSEs or A-levels or degrees, but also now master's level apprenticeships and above. And really just wanted on this slide just to give you a little taster of some of the master's level apprenticeships that are either already developed or are in development. A little bit of a word of warning here though, in terms of apprenticeships, in that just because an apprenticeship standard has been developed and approved for delivery doesn't mean to say that that equates to vacancies yet. We're seeing a little bit of lag time in terms of apprenticeships being ready and then employers actually advertising them and them being available, particularly to external people that aren't already members of staff. So it's just something to bear in mind, that just because these are either developed or in development, that doesn't necessarily equal vacancies yet, but we anticipate more and more will come. And the HASO website there that I've just linked there is where, if you want to find out and see which apprenticeships are in development, you can have a look and you can see which stage they're up to. But it's really exciting because these are really opening up particular professions and roles to people that might not otherwise have been able to access them because of, you know, the fact that you are getting paid while you're studying. So it's really good to see these becoming more popular. Okay, this is really, really important. This is as important as the qualifications you hold, okay? Values-based recruitment. The NHS as a whole, and also universities and other course providers that provide healthcare related courses, are doing what's called values-based recruitment now. Because we want to make sure that in the NHS we have the right type of people, whatever role they're doing, that they hold the values that fit with the NHS's core values. So these are the 6 values taken from the NHS Constitution, and I would really encourage any of you who are either thinking of applying for training or courses or jobs within the NHS, do your homework on this. Look at these values and think about how you can evidence that you hold these values. And that can be from a number of ways. It can be from experiences you've had in your home life, experiences you've had during maybe work experience or placement or volunteering, or during your university life or a part-time job. It doesn't really matter where you draw those experiences from, but it's about your ability to relate your experiences to evidence that you hold these values. So be prepared at interview to be asked questions about these. You might be asked, something like, can you tell us about a time when you've shown respect and dignity? Or, what does compassion, when have you seen compassion being shown? What did it look like? What does commitment to quality of care mean to you? How do you think that's evidenced in the workplace? I'd encourage you as well, if you can, to weave that into supporting statements, personal statements, that kind of thing as well. Really, really key for you to be aware of. Okay, I'm very aware of time and I need to stop talking soon so we've got time for questions. So just quickly, just to talk about financial support for healthcare students. You may have seen in the media towards the end of last year, early this year, that there some financial support has been brought back in for healthcare students. So the NHS Learning Support Fund has been expanded from now. And there is a training grant available of £5,000 a year for eligible students studying nursing, midwifery, and many of the allied health profession pre-registration courses. And this applies if you are already a graduate as well. Okay, so if you are a graduate, so say for example, you're a psychology graduate, you want to go off and study to become a mental health nurse. If you meet the eligibility criteria, which are the same as the ones for student finance, so mainly around residency, then you will be eligible for this training grant of £5,000 a year. There are other elements of the fund as well for eligible students, so £2,000 parental support for those with dependents, £1,000 a year specialist subject payment for new students. So again, coming back to the example of a psychology graduate going on to do mental health nursing. Mental health nursing is one of the real areas where we need more people coming into it, and there's therefore £1,000 incentive per year during your studies. Certain regions will also benefit from another £1,000 a year, but we're yet to hear from the government what those regions are. And then there's help towards travel and accommodation costs for placements and an exceptional support fund for exceptional financial hardship. More information can be found about this on the NHS Business Services Authority website. Again, it'll be a link at the end. And student finance. So the good news is that most new pre-registration healthcare students are eligible for student finance, even if they are graduates. And that's really in recognition of the fact that we want to encourage as many people as possible into healthcare roles. Again, have a look on the government website for the eligibility criteria to see whether you would fit those criteria or not. But there is help out there. Obviously, if you're doing an apprenticeship, that attracts a salary. And many of the graduate opportunities that I've covered are salaried training positions. So the graduate management training programme, the scientist training programme, many of those psychological professions that we discussed, and the graduates into health programme, to name but a few. So there are lots of options where you can be paid while you are undertaking these programmes. Okay, very quickly to give you a quick sort of tour of the Health Careers website. All sorts of information on here. There is, you can navigate the site using these tabs along the top here, which will bring up a mega menu, and you can register for an account with us, which will give you more personalised information on the homepage, and obviously a search facility there. And then down at the bottom, various videos, day in the life of videos, different resources, and also any events that are coming up. And you can see there at the bottom middle, the NHS Values and Behaviours link, which I've just talked about. So please do have a look at the Health Careers website if you haven't already, because there is a lot of information on there. Just going to skip over this. Find Your Health Career tool. This is a really popular tool on the website. It takes you through a series of questions/statements, and depending on how you respond to those, it will bring up some suggested roles that match your interests. The first 50 or so questions you can do without being logged into the site, but to open up another set of questions which will help bring up a more specific set of answers, you need to be registered with us and logged into your account. But it might be really helpful for those of you that aren't quite sure what you want to do yet. So do have a look at that. And there is a course finder tool. So this is really handy if you want to search for postgraduate accelerated courses in particular professions. Then it'll bring up a list of those, and within each entry under there, you'll be able to click into the actual university's website and find out more about entry requirements, etc. So that is under the career planning tab on the homepage of the website. The NHS jobs website, I'm sorry, I'm aware I'm really speeding up now because I want to make sure we've got plenty of time for questions. We're nearly at the end of the presentation. This is a great tool. Not only are there hints on kind of applications, interviews, etc., but you can also register for email job alerts. So if you register with them and say, for example, you're interested in becoming a children's wellbeing practitioner, you can do a search for a trainee children's wellbeing practitioner and save that search and request email alerts when something's advertised. Also use it, search for vacancies that are interesting to you, and then look in the person specification and see what they are asking for. There is a named contact as well with most job adverts. Phone them up, get in touch with them, see what they're looking for. Even if it's not in an area, of the country that you're interested in, it's just a really helpful way of getting more information about the sorts of roles you need to be looking for, if you need any more experience, if you need any further training. So do use the NHS Jobs website. To get in touch with your local NHS organisations, on the NHS Jobs website, there's this really useful map which will bring up the contact details of your local organisations. And here are just some of the links that we mentioned. So that is it in terms of me chatting away. Sorry, it was a little bit of a rush towards the end, but the time's gone fast all of a sudden. So we have got the chat function that you can use now to get in touch with us. But as I said, if we don't get round to answering your questions today, or if you've got something very, very specific, please get in touch with our contact centre. It's advice@healthcareers.nhs.uk, and the phone number is there if you want to phone them. And there's a set of useful links on the side. I hope that's been helpful. It is a bit of a whistle-stop tour because there are so many opportunities, but thank you very much for listening. And yeah, we're going to take some questions now, and we're also going to do a quick poll, actually. Sharon.
Right. Before you start the poll, I just want to tell everybody, because one of the things that we've had a lot of fantastic, very specific career to individual sort of questions, and unfortunately we won't have time to get through all of them. So you will see in the chat box. Can you tell me if you can see it as well, Abby? I put up the advice email that you can send things through, and the phone number as well. So we do have some broad questions. We have not enough time to go through everything, but I also wanted just to reassure everyone that this session is being recorded, and it will be made available in the our Careermap Live. Jodie, if you wouldn't mind typing in the chat box the link to the Careermap Live. It will probably be next week because it is National Graduate Week and we've got lots of these fabulous sessions. So but on to some sort of broad overarching ones. And do you want to do the poll first there, Abby?
Yes, I think that would be great if we could do the poll. It'd just be really interesting to find out, who's here, what your interests are, whether there's particular, how many people are interested in the science, how many interested in psychological professions, etc. So, yeah, if you wouldn't mind taking part in the poll, that would be really helpful.
Okay, well, while we're getting the poll set up now.
Sorry, Sharon, I've just seen a query about work experience, or a couple of queries about work experience, and actually this is an overarching one just for me to mention, in particular in terms of COVID. So obviously getting work experience has been even harder within health over the last few months, and will kind of continue to be so, unfortunately. the thing to be aware of is that employers and universities and course providers are aware. They of course are aware that this is the case. So there will be more flexibility. So I think our advice would be, again, speak to employers, speak to admissions tutors, see if there's any ideas at all they've got, or if they can just reassure you that it's not as vital as it would have been in other years. So I know it's really difficult not to worry about it, and obviously keep knocking on doors, keep trying, but this is an exceptional time, and employers and education providers know that.
Absolutely, and in fact that leads on really nicely to the sort of broad brushing question. It's something that's been a running theme throughout National Graduate Week, is the impact and changes that COVID has had on both recruitment, on what it means for new starts, people on training, bearing in mind things about remote working, and that aspect of starting the job when you may normally be shadowing and so on.
Yeah, thank you, Sharon. That's really good question. So you'd have already seen from the presentation that the graduate management training scheme, has pushed back its September 20 start to March, and that is the case with some other things as well. But I think it's right to say that nothing has completely stopped. So things are still in train, and actually we are going to see expansion in certain areas. So if you think about particularly COVID and the sort of body systems it impacts, so potentially respiratory scientists, cardiac scientists, certainly roles within the AHPs, so physiotherapists, occupational therapists, etc. We will probably see an expansion in terms of availability of these roles, because we're going to need more of them. And I would say the same, psychological professions were already growing, but with the impact of COVID as well, I think without doubt that we'll see those growing as well. So a mixed bag, I think, in terms of what's slowed down, what's maybe being postponed, and what is growing as a result. In terms of starting in a new role, of course, it's not ideal if you can't meet your colleagues face to face when you're starting a new role. But again, people know that that's what's happening, and people are making adjustments, and we are all sort of getting used to this virtual way of meeting people, of getting to know people. Obviously, for many clinical roles, it's almost business as usual, and you would be going in for induction procedures and that sort of thing, but socially distanced within those training rooms if it can't be done remotely. The use of things like virtual work experience as well is really taking off, and simulation as well, because these are ways that we can get round the distancing problem.
In fact, as it has actually been another theme through the week, is the absolute career vacancies and expansion of the AI and data sciences roles. And I know, having dealt with the NHS quite a lot, that is a big area that you guys across almost all parts of the NHS are looking for. But really, anything to do with that sort of area is a real career step forward, I would suggest. Before we carry on with another question, you talked about the poll. You should be able to see yourself, Abby, the red dot. You can have a look. I'm absolutely thrilled with this session. We've had almost over, nearing 700, 650 joining in. I've asked that we keep the the poll is closed now. So as you can see, and you quite rightly mentioned, for those who can't see this, it's the science. 38% of you are in the sciences, 13% are in the psychological professions. We've got 13% in management, 9% in clinical roles. I did see the question, people are asking what IM and T is, but we haven't got anybody in there anyway. And then a small amount in HR, finance, and other. So thank you, everybody, for taking part in the poll. That's great. I just want to reiterate again that if you want to scroll through, if there's any links, or if you want to make a screenshot of the slide that we have up now with all the contact details, please do so, because we're going to be wrapping up. I think we might have time for one more question. And then this will be, as I said, recorded and available on careermap.co.uk/Careermap live, but that will be next week because we're quite busy. So one last question. Do you have one that you want, or I've got an overarching one as well?
Oh, no, you fire away, Sharon.
All right. Yeah, so one of the things I've noticed is obviously we had the psychology, but there's also obviously with COVID and the coronavirus, the mental health roles and the increased need. And I would hazard a guess, and I'm sure you can say more about this, that this is not going to be just for the next few months. The rollout from this is going to be quite a bit wider. If you could just give us a kind of as snappy as you can answer kind of the view of the world at the moment, and what maybe the NHS is preparing for as we go on.
Yeah, so psychological professions, as I've already mentioned, we were already seeing that expanding. Certainly, you know, I've mentioned 2 or 3 newish roles in the psychological professions just today. So the children's wellbeing practitioner and the education mental health practitioner. So that expansion was already happening. But yeah, as we said, with COVID, it's likely that, you know, we will see even more of that needing to happen and being delivered in different ways. So more, you know, again, not all relying on face-to-face, but the virtual kind of approach as well. And the great thing about many of those roles is that they are paid for training positions, which quite often lead to more or less guaranteed posts at the end of it. But as I said, getting experience doesn't have to be in exact. So for example, if you're interested in being a children's wellbeing practitioner, you don't necessarily have to have worked within children's mental health services to get that experience, but you obviously would need experience working with children and young people in one way or another. So just be aware with many of those that experience as well as the right qualifications are really key.
Great. Well, it's been a fabulous session and really informative, an awful lot to pack in. But I think you did a nice canter through. Lots of lovely links there to get further information. And as Lou put in the chat, there's a specific email address to get the more specific questions. I'm sorry we couldn't drill down for everybody, but we couldn't do careers advice for everybody on a webinar, but we can certainly get the information from the email address on the website, and you can ring the helpline. So for now, we're going to have to wrap up, and hopefully we've answered as much as we can. I'm Sharon Walpole from Careermap and National Career Week. National Graduate Week. I'd like to thank our guest, Abby. So it's goodbye from me.
Goodbye. Thank you, everyone, for coming along.
Have a good afternoon. Thank you.
Bye.